Do I think addiction is hereditary? I'm sure those of you that have come from an addict family or an alcoholic family can agree that when you come from that sort of family dynamic, that you can't help but look and go, well, look at the line of people that have passed this down. Now, is it, some people think it's a gene. Very interesting to me. Some people think, oh, it must be learned behavior, because I watched my parent deal with life or deal with things that were difficult by drinking. Is it generational trauma? Because I would definitely say that there's issues that have sort of gone through my family lineage and through the family tree that have made it this far, and that I plan to put a stop to.
I think there's a temptation to want to find the single thing that causes addiction. And ultimately, I also wish that was true, because then we could tell whether you were going to have problems with addiction or not. And ultimately, there isn't just one thing. It's a kind of loading of lots of small changes in your genetics and also different ways of coping with different stressors. Absolutely, there's a genetic component. Absolutely, there's also a coping skill style that is passed down. So I think it's all of the above. But the positive of that is, even though you have some vulnerabilities towards addiction, absolutely you can get through it. So there's no, my family were addicts, therefore I'm going to be an addict for the rest of my life. That's just not true.
That's fine, but what was it within me that had no ability to stop or to say no? Because there's something that's set off in me when I have a drink that goes more. No ability to stop or control that. No impulse control, if you will. A lot of chat about ADHD and neurodiversity on here and in the addiction community, and about what that means for people. There seem to be a very large number of people with ADHD or that are neurodiverse that have dealt with that, and society's lack of understanding for that through substance abuse.
I'm really glad that you mentioned neurodiversity, especially ADHD. I find with my patients, about a third or a quarter of my patients probably also have a comorbid ADHD that may or may not be diagnosed. And often when I see them, it's an opportunity to go through that. Obviously, that's an element of impulse control, but also lower dopamine thresholds. And it's something that is really, really common with addiction.